Good afternoon. My name is Jeevan Shrivastava, and allow me to welcome you to the 3D Link Initiative, Designing, Developing, and Distributing Life by Integrating Novel Creations. During this presentation, you will hear a range of information, starting with how COVID-19 affects heart health, and finishing with what our community is doing to combat this pandemic. You'll even get to see a 3D printed product created by our very own Scarf ambassadors, Josh and Inene. And on that note, I would like to hand it off to my colleague Ashley, who will be discussing the basics of COVID-19 and cardiomyopathy.
Thank you, Jeevan. COVID-19 is an infectious disease caused by the newly discovered coronavirus. So, viewing from a cardiac standpoint, how does COVID impact heart health? Well, to begin, some prevalent COVID complications include inflamed heart muscle and lowered oxygen levels. One aspect of COVID that truly shows the effects of the virus on heart health is the angiotensin-converting enzyme, also known as the ACE2 receptor. In a healthy person, the ACE2 receptor lyses a protein known as angiotensin-2 to stabilize blood pressure. COVID-19 binds to the ACE2 receptor to infiltrate cells, preventing the regulation of angiotensin-2. As the heart expresses the ACE2 receptor, the inhibition of ACE2 to properly regulate angiotensin-2 can lead to myocarditis and cardiomyopathy. So let's talk about what cardiomyopathy really is. Cardiomyopathy is the leading cause of ventricular tachycardia, which can lead to sudden cardiac death. It is defined as diseases of the heart muscle, and there are a few main types. To start off with dilated cardiomyopathy, in which the heart muscle stretches and becomes thinner, and the inside of the chamber is enlarged. Then there's arrhythmogenic right ventricular dysplasia, in which the heart muscle in the right ventricle dies and is replaced with fatty tissue, which can disrupt the heart's electrical signals. Then there's restrictive cardiomyopathy, in which the heart's ventricles stiffen due to abnormal tissue, such as scar tissue, replacing normal heart muscle. There's a specific type of restrictive cardiomyopathy known as transthyretin amyloid cardiomyopathy, in which amyloid protein fibrils made of transthyretin deposit onto the walls of the left ventricle, causing them to stiffen. Lastly, there's hypertrophic cardiomyopathy, in which abnormal genes in the heart muscle cause the heart to contract harder and thicken. All of these types of cardiomyopathy can lead to arrhythmia and reduced blood flow throughout the body.
One of the many conditions associated with hypertrophic cardiomyopathy is atrial fibrillation, also known as AFib. AFib is an arrhythmia of the atria in which the atria quiver rapidly out of coordination with the ventricles, resulting in an ineffective movement of blood normally. Because blood cannot be pumped normally, abnormal blood clots can form within the heart, eventually leading to a stroke. AFib affects between 2.7 and 6.1 million people in the US. And this disparity in numbers shows not only how common it is, but also how often it can go undiagnosed. Patients with AFib and severe cardiomyopathy could be subject to a heart transplant, but recently doctors have been looking for other viable options, such as 3D printed hearts, which will now be discussed by my colleague Alina.
Thanks, Jeevan. Over the last 6 weeks, I have been researching 3D printed hearts. I found that scientists have 3D printed a heart using human tissue and a small amount of fatty tissues from the patient. In the lab, the tissue is separated into its component cells and the structure in which the cells sit, also known as the extracellular matrix. The extracellular matrix is the non-cellular component present within all tissues and organs. In order for blood to pump efficiently throughout the body, the cells need to be in unison. Currently, a 3D printed heart is far from functioning like any normal heart. Once the heart is made, the size is as small as a rabbit's heart, as you can see in this picture over here. At this time, a rabbit's heart is beating on its own and is made from bio ink. In order to print a full-size, fully functional heart, scientists need to print a higher resolution organ. 3D printing will help ease the shortage of transplant organs available to patients. For instance, a patient who needs a heart transplant would have to be on the waiting list for more than 6 months, and this is without knowing if the patient will even get a heart or not. On the other hand, a 3D printed heart will only take an estimate of 3 to 4 hours to print, and it would be a custom heart for the patient's body. Now I would like to pass it on to my colleague Josh, who will discuss 3D printing for ablation.
Thanks, Alina. A common complication of cardiomyopathy is atrial fibrillation, and AFib can be currently treated with medications and ablation therapies. There are currently 3 established ablation procedures: catheter ablation, Mays procedure, and AV node ablation. First, let's talk about catheter ablation. This isolates abnormal electrical signals within the pulmonary veins by using extreme heat or extreme cold to burn the surrounding tissue. Second, we have convergent procedure. Now, this is a relatively new procedure consisting of a catheter epicardial ablation as well as a pulmonary vein ablation. Third, we have maze procedure. This is a surgical procedure in which scar tissue is made by manually cutting the surface of the left atrium. This is also paired with a pulmonary vein ablation to scar the inside. Lastly, we have AV node ablation. This is a catheter ablation directly affecting the AV node. Now, all four methods intend to block or isolate abnormal electrical signals to bring the rhythm back to sinus. However, a limitation of ablations is that signals can almost slip through due to a changing atrial structure. For instance, a patient with cardiomyopathy has a 2 times greater risk of recurrent AFib after their first ablation. Now, 3D printing can improve upon current ablation procedures. Instead of merely blocking or isolating these abnormal electrical signals, what if we could bypass or redirect these signals, like plugging in a lamp from the wall into a surge protector? 3D printing has the ability to do this because of newly engineered bioink to effectively differentiate into electrically functioning cardiac cells. Better yet, these printing orientations can be shared via telemedicine for more rapid, more direct hospital-to-patient transplantation. To bring our presentation a little bit closer to home, I would like to hand it off to colleagues Anene and Jeevan to talk about how 3D printing in our communities can improve COVID prevention.
Throughout this year, we have seen a massive displacement of resources within this country due to various issues within our supply chain. We have seen hospitals suffering from a lack of basic supplies, such as N95 masks and ventilators. As a result of the strain put on hospitals, some have turned to the 3D printing community to manufacture essential supplies and PPE, such as face shields and ventilator valves. Through consumer 3D printing, several communities have been able to offset the lack of supplies and have started to rely on their own communities. We have seen stories of schools and students 3D printing hundreds of masks for their medical facilities and at-risk communities. My colleague Nene, along with a friend, donated 45 face shields to the Alden network of retirement homes. In many of these cases, we can see community members rising up against a government organization to fulfill the needs of their local communities. Combined with technologies such as data analytics through Python, community members can accurately determine the struggles that community members face during pandemics and can support each other accordingly.
One of the many things we were able to do was we were able to take survey data of over 6,000 people based off of a survey conducted by a nonprofit within the Chicagoland area. And using the survey data, we were able to create a data visualization. We did this by using a popular programming language called Python, where we were able to parse through all 6,000 plus responses and search for certain keywords such as food, money, and PPE. From these search parameters, we aggregated this data into this graph or data visualization, as you can see here. Based off of new technologies like this, nonprofits and other organizations alike are able to efficiently deduce the problems plaguing their community, as opposed to having to rely on someone simply go through all this data and tally up all the responses and see what the community needs in a very inefficient manner. From there, nonprofits and other organizations are able to adjust their supplies of goods in order to meet the demands of the community. Over the past few months, we've also seen the creation of new groups called mutual aid groups. These groups operate much like how we envision the future of our communities, where they operate based on the principle of a neighbor borrowing a cup of sugar. These mutual aid groups provide a platform for those who are less fortunate to make requests directly to members of their community for necessary supplies, where those who are more fortunate are able to donate back. These mutual aid groups are able to offset the imbalance of goods within the community and allowing for communities to become much more self-reliant as opposed to reliant on an outside government organization. Over the past few months, we've seen a growth in the anti-mask movement within the United States. We have to face the music that people simply do not want to wear face masks. Not only that, but the people who do choose to wear face masks can only do so much to prevent the spread of COVID. As we're doing research on possible ways to combat this, we came across an ad for an off-brand bug spray product, which would utilize a fan as a delivery mechanism to distribute bug spray across the body, to provide for 12-hour protection from bugs. Based off of this idea, we decided to create our own filter, which, based off of the same principle, would hold an antiviral solution, which through the same mechanism would carry the antiviral across the body. We created this antiviral based off of research done by Kleenex in combating the influenza virus. In their antiviral tissue line, they utilize a combination of citric acid and sodium lauryl sulfate to combat the influenza virus, with the sodium lauryl sulfate acting as an agent to destabilize the viral envelope and the citric acid acting as an agent to denature the virus. However, there's still much more research that needs to be done as to how the solution would work against COVID. While the influenza virus and COVID are both coronaviruses, we still don't know as to how effective it is against the coronavirus, against COVID. Not only that, but we also still have to do research as to the distribution mechanism, whether it's effective, whether it's efficient in its manner.
With COVID-19, atrial fibrillation complications of COVID-19 calls for a 3D link between our communities and technology. And here at SCARF, the future is what we create. Thank you.